Welcome back to Shatterproof Speaker Series. I am Renee Barros, Community Engagement Director here at Shatterproof, and I moonlight as the host of this series. Joining us today is well-respected physician and educator, Dr. Nzinga Harrison. Dr. Harrison is the Chief Medical Officer and co-founder of Eleanor Health, a value-based provider of compassionate, comprehensive outpatient addiction treatment. Approachable and energetic, she has been known to explain medical concepts with an ease and humor that results in her audiences developing an understanding of difficult material while having a good time doing it. She has written and presented several articles and workshops on medical aspects of addiction and other psychiatric disorders and has consulted on the same topics both nationally and internationally. Despite the credentials, she prides herself on being a regular old person who loves regular old people and doesn't mind going by her first name. Welcome, Dr. Nzinga Harrison.
Thank you so much, Renee. Oh, let's see. We'll get my video started. Thank you for that lovely introduction. And yes, please call me Nzinga. We're all friends
Oh,
here.
perfect. Well, before we get started, I have to thank you again for being the host of our Stronger Than Addiction Challenge back in September. That's one of the big events that I manage, and you seamlessly and professionally hosted that like you were born for it. We just got so much great feedback. So
Oh,
thank you
wow.
again.
Thank you. The production team was so amazing. They made me look like a professional.
Well, you helped them as well, I'm sure. I'm so excited to talk to you because I have been eating up the In Recovery podcast and just loving it. You really do have a way of taking super difficult topics and unpacking them in a way that breaks them down into digestible, bite-sized pieces that everyone can consume. Did you always work in the addiction space? Tell us your journey and how you got here.
Yeah, actually, the answer is I did always work in the addiction space, even though that's not the space I thought I would work in when I went to medical school. So I went to medical school with intention to be a pediatric surgeon.
Oh,
And in medical school, you have to do rotations in every major system of the body before you get your MD, one of those being psychiatry. And psychiatry just stole me from surgery. It
oh.
was like so biological and so based in relationships. And I was fascinated about how much of our behaviors and interactions are actually chemical and electrical as much as we think we're like controlling everything. And then I was really pulled in by how uncompassionately, I know that's not a word, but that's the sentiment that I'm trying to convey, that people with mental health disorders and substance use disorders were treated by the healthcare system. And I was raised an activist. And so I was like, activism, advocacy, medicine, biology, relationships. It was everything I needed. And so I chose to be an addiction psychiatrist, and here I am.
Wow, great choice. Um,
And so
so then, so I know that the In Recovery podcast was born out of the Last Day podcast. Can you talk about how this all came to fruition?
it's a beautiful story. So you mentioned that I'm co-founder and chief medical officer of Eleanor Health. And one of our founding board members is Andy Slavitt. Your audience may know him now as like COVID expert. He's helping with the COVID response for the Biden administration. And so he knew Steph and Jess from Lemonada when they were doing the Last Day series. And he called me up and he said, I know this great new company. They're doing this series on the opioid crisis. They're looking for an expert to kind of come in and fill in some gaps about treatment. Would you be open to going on the show? And I was like, yes, love it. And
Good.
so went on the show and met Jess and Steph, and it was love at first ears because we were not in the same place. I was like in a studio by myself and did Last Day and just really felt the impact of that. And they felt like I connected well with the audience. And so as they were thinking about the next podcast after Last Day, they really wanted to do something hopeful about recovery and reached out and asked me if I would be part of it. And the rest is history.
I love it. I saw that you were a guest host on a couple of different episodes that they had. And one of my favorites was episode 23, where you really describe um, Eleanor Health and how it all works. And would you mind breaking it down for everybody, the treatment approach that you take at Eleanor Health?
Definitely. So the way we describe Eleanor is that it's rooted in several guiding principles, but very importantly, the understanding that substance use disorders are chronic medical conditions, and
Mhm.
that when people are sick, they need compassion and warmth, which is unfortunately not a lot of what you see in addiction treatment, where the idea is like, if you just made better choices and were a better person, you wouldn't be addicted to drugs. And so it's turning that on its head, but also when you understand that addiction is a chronic medical illness that has periods of relapse, periods of remission, but is a chronic illness, then you know you can't just detox someone for 3 days, or you can't just be in a 3-week intensive outpatient and think that you're cured any more than you would think that with diabetes or asthma. And so we really position ourselves kind of like the primary care, continuous thread of compassion, helping people navigate this healthcare system. And so yes, we provide medications for substance use disorders, Suboxone, alcohol use disorders, Camprol, naltrexone. We have licensed clinicians that provide individual, family, group, couples therapy. We try to wrap around the entire support system. We have nurse care managers that help people navigate their physical health care needs. And we have our peer coaches who really help with life meaning and purpose and removing those barriers that drive kind of active substance use. And so it's this compassionate whole person, but very importantly, longitudinal approach. So, like, yes, if you have to go to a detox, we'll help you get there. And like your primary care doctor, we'll collaborate with that team and we'll be here for you when you get out, to draw that continuous thread of support over the life of the illness.
The way I heard it explained, and I think you used the words wrap around, like
Yeah.
you take the individual and wrap around them. What are their goals? What is it that they need? Where do we need to fill in the gaps? And
Yes.
another thing that I heard you talk about that I thought was so important was how relapse is a part of recovery. And so many other treatment facilities will kick someone out if they test positive or relapse in any way. And those are the people who need the help the most. So,
Most, right? Like, can you imagine? And so sometimes it like makes people bristle when you say relapse is part of the illness of substance use disorder, because it sounds like you're gonna relapse. And that's not what it is. It's like in medicine, we have conditions that we call relapsing, remitting. Diabetes is one of them. Your diabetes could be perfectly controlled with your medication, your diet, your exercise, you're keeping your stress low. And then some combination of things happens and your blood sugar goes up. That is a relapse of your diabetes, right? That's not an indictment of you as a person. Can you imagine if your blood sugar went up and your primary care doctor said, nope, you obviously weren't ready for treatment, or else you would have kept your blood sugar down? Like,
never happen.
it would never happen because it makes no sense. And so, yes, at Eleanor, we take care of people at every phase of the illness. Obviously, the whole goal is to prevent relapse. That takes biological, psychological, social intervention, social support. But it also is when people are sick, in this case, that symptom of the illness is using, that's when people need more care, more treatment, more arms, more warmth, more compassion.
Amen, sister. I'm so glad you guys, it sounds like you have it right, spot on right there. And I'm so happy to hear that Eleanor Health is expanding. So congratulations on that.
Thank you.
Switching topics a little bit, you did a captivating podcast on race as an addiction. I would love to dive into that a little bit about just addiction. I want to raise your voice on this. I want to hear what you have to say. Can you talk about the definition of addiction and how racism can be defined as an addiction? Because honestly, when I listened to the podcast, or when I first went to listen to it, I was like, what does she mean by that?
Mhm.
And then once you explained it, I'm like, this is perfect.
Yeah, and so the definition of racism that we use on the podcast in recovery is continuing to do something despite the negative consequences outweighing the benefits. And we used that thesis of addiction because the whole goal of the podcast in recovery is to break down the barriers that we think exist between people with addiction and people without addiction, right? Like somehow there's a difference. And it's like every single one of us in our lives is doing something that the negative consequences have begun to outweigh the benefits, but we keep doing it. And then when you pour on like chemicals and biology and brain chemistry and all of this business, you can develop that compassion and understanding for the substance use disorder. When I talk about racism as an addiction, it's this concept that if you consider the United States as the person, racism is the behavior that we keep doing, even though the negative consequences are outweighing the benefits. And if we allow ourselves to conceptualize it that way, like we have so many evidence-based interventions that we know work for addiction, you can apply them to the concept of racism and it starts to give you like a roadmap for developing awareness. The first step is recognizing we have a problem, acceptance, right?
Eliminating stigma.
Eliminating the stigma,
Is
talking
racism
about
not the
it,
world's
right?
biggest stigma?
Absolutely, absolutely. Like so much can apply that empowers us to kind of like take on this addiction of racism. Because the other thing I say is no human continues to do something that doesn't have benefit.
Yes.
And so it makes you take a look like, what are the benefits of racism? How do we get those benefits elsewhere, right? If those are actually benefits, while addressing the racism so that we can erase the negative
And
consequences.
who are the consequences falling on, and shifting the dynamic.
That's right.
That's how
That's
we
right.
fix the problem.
Yep.
So, can you break down for a second just how racism impacts addiction, specifically talking about like disparities in treatment and things like that?
Yeah, absolutely. So we talk about the magic formula on In Recovery, and it's this concept we have in medicine that all illnesses develop for biological, psychological, and social reasons. And so if you're trying to treat an illness, you have to treat it biologically, psychologically, and socially. And so that's kind of that model that I just described at Eleanor Health. I've broadened that concept to say illnesses develop for biological, that's like genetic reasons, or you get in a car accident and you get prescribed pain pills, and then that puts you at risk for developing an addiction. Psychologically, we know adverse childhood experiences, early developmental instability literally predicts like 1, 2, 3, 4, 5 times risk for developing substance use disorder or mental health conditions in adolescence and adulthood. Socially is your support system, stressors. But we have to look at cultural politically, and this is where racism, marginalization, oppression, discrimination, we know that those experiences affect health. And so if we want to really take a look at how we can make an illness better, we have to look at how has racism, oppression, marginalization, discrimination contributed to the development of that illness. So if we look at racism and addiction from inputs, one, generational trauma that Black people have experienced in this country literally changes biology through epigenetics and puts Black people at higher risk for developing depression, anxiety. We know depression and anxiety put you at higher risk for developing substance use disorders. Cultural, political, social political constructs, we know that there are disparities in every system that we have, education disparities, criminal justice disparities, wealth disparities, housing disparities, that falls into that social bucket of stressors that drive risk for developing substance use disorders. When you look in healthcare, although people in Black communities with substance use disorders seek substance use disorder care more often, there are
Mhm.
more barriers to actually accessing that care.
Mhm.
We know as a Black person, you go to the emergency department with an opioid overdose, you're up to 35 times less likely to be prescribed Suboxone, the medication, one of the medications that we have for opioid use disorder. And so when you look at the combination of life experiences that increase the risk biopsychosocial, cultural, politically for developing substance use disorders, and then you look at the access barriers, and then you look at the disparities in evidence-based treatment, then you can see how racism is really affecting the course of or ability to get to a course of recovery for people of color. And that same line of thinking actually applies to people in our LGBTQ community. It applies to people in our rural communities. It applies to people in our immigrant communities, to people for whom English is not a first language to varying degrees. But racism, oppression, marginalization, discrimination drives the development of the illness and erects barriers to accessing treatment for the illness. So it's double whammy.
Absolutely. So what has been the response to that episode? Because I know for me personally, when I listened to it like, what does she mean by that? And then I listened to it and I was like, I know what she means by this. And oh my gosh. I even shared it in our general Slack thread here at Shatterproof and was
Oh,
like, you guys
wow.
have to listen to this. You talked a little bit about Eleanor Health's response after like all the George Floyd stuff happened and how they were like, it was a much better response than you expected. Has that been the response to that episode as well? Like,
It has been. And so I've been so encouraged, excuse me, encouraged and hopeful over the last year because of the just like, what do you call it? Giant leap forward in the ability to even say the word racism in public. And then to even like have a conversation about it where truly you're just talking about like, this is a true experience that has impact on people, because before a year ago, that conversation was not welcome at work unless you were specifically working in like a racial equity environment. That conversation was not welcome on a podcast about health. That conversation was not welcome at the bar. Not that any of us have been to a bar anytime soon, but anytime recently, like at the restaurant with friends haven't been there either. But so I was really surprised. I felt like it was a bit of a risk to do that podcast episode because I didn't know how it would be received. And it is one of the most listened to podcast episodes, one of the most shared episodes. And it really, like, people are saying the same thing that you're saying here, which is like, it gave me a way to have this conversation that I wouldn't have otherwise been able to have it. And so I've just been really encouraged by the progress we've made as a country over the last year and being able to have the conversation, but specifically about how that episode was received.
Well, I have to say, and at the risk of making myself sound kind of ignorant, but I'm going to be vulnerable and share it anyways. When Jackie sent me the list of episodes to listen to and I saw that one, there was a part of me that was like, oh, I know this is a really sensitive topic and I should just probably not touch it, especially being a white person. I listened to that episode and I was like, I'm missing the point completely. If I don't talk about this, I listened to that episode for no reason at all, because the whole point is just like we want to eliminate stigma in addiction. And how do we do that? We talk about it.
Yay!
Make it okay. And so I'm so glad I went down this road with you and even shared my moment of ignorance.
No, you're taking me
I'm
to church
learning.
today. Yeah, you're taking me to church because this is what we say at Eleanor. So every single person that joins the Eleanor team, we have a training called Culture, Oppression, Racism, and Recovery. That's a heavy title.
Yeah.
That is a heavy title for a training. The purpose and the intent of the training is to establish our culture at Eleanor, which is we try, right? We assume good intent from each other. I know you're not trying to hurt me. You're trying, and in trying, mistakes will be made. The only way you do it wrong is not to try, right? And so, yes, please make a mistake and then create the environment where we talk about it. And I say, this is how that made me feel. And you say, I didn't even realize that would have been it. I'll try not to do that again. This is how we remove the stigma. This is how we move forward. So I
How
love
we
that
get
you shared that.
healthier as a society,
That's
right?
right. That's right.
Yes,
I
and not
love
just
that you shared
cancel each other out. So moving on to season 2 of In Recovery, what would you say is the overarching theme of that?
So in season 1, the overarching theme was really like addiction does not separate us. All of us have some experience where we can understand this and we can have the conversation and we can develop empathy and compassion because that's the way forward. And it was really focused on all things addiction. Season 2 of In Recovery is really focused on all things recovery. So over the last year, we have all experienced a collective trauma that is life changing. No matter who you are, no matter what your experience has been for the last year, it is life changing. And we have all lost something. We have all changed our concept of what it means to be moving through life. We've all changed our concept of who we are and what we need. Like big changes have happened. And so this season is all about how do we take the experience of the last year and together move towards reconstruction and recovery from a mental health perspective, from a substance use disorder perspective, from a human perspective, from an identity perspective, just like how do we recover from the experience of the last year?
Yeah, so working in the addiction space, I talk with people all the time that are in recovery. And one thing I commonly hear all the time is the things that are good for people that are in recovery are just good for the average person.
That's right.
So in 2021, we're all in recovery from something, right? 2020 was a wreck for so many reasons. They often say, and people in sobriety, I should say, often say that the opposite of addiction is connection.
Yes.
The opposite of COVID is disconnection. Can you talk a little bit about that?
Yeah, the opposite of addiction is connection is one of my favorite quotes of all times. I think I try to say it like every time I'm talking to anybody about anything. I even take it to the next step, which I'm like, I think connection and relationships are the foundation of all things health. Like if you want to be healthy, and so we can, we can put that in addiction specifically, but just like health, period, mental health, physical health, social health, identity health, all of that to me is relationships and connection. And so I think COVID tried to sever that for us over the last year, right? Like you can't get together. But we're resilient. We're resilient as human beings, and we use technology to stay connected. And we got creative about, being 6 feet and sitting in a little pod. I like saw a restaurant that had individual little pods, but the people were still together. And so I think if we start with that for the next year, we can look at everything we learned over the last year about how to connect even when we're not in the same physical space. And we can join that with being able to be in the same physical space together. And I think we use our connections and our collective experience to try to come out stronger.
Yeah.
More connected.
I hope that is the outcome of it, because I was listening to one of the morning shows the other day, and they said that they expect the 20s, like the 2020s, to be another roaring 20s, like the 1920s, because we're going to come out of this and be so starved for connection that it's going to be kind of over the top. But I hope that in the same way the pendulum swung, to disconnect everybody, that it swings back the other way and reconnects everybody. And especially people with substance use disorder find a way to heal And I hope that that massive reconnection of people helps with that.
I agree with that so much. And I think we're seeing the beginnings of that. So like, just like the last year brought in a brand new way the opportunity to talk about racism openly and start like reducing the stigma around that conversation. The same thing happened really around mental health and addiction. And so even like I've been doing a lot of kind of public education because we know that drinking is up 3 to 4 times. We know that illicit drug use is up. We know that misuse of prescription medications are up. We know that stress and depression and anxiety are up because people have really been struggling. And so there's been this acceptance over the last year to be able to say, I'm struggling, to be able to say, I'm worried about how much I'm drinking since the pandemic started, to be able to say, I know I'm taking more of these sleeping pills because I can't sleep because of the stress that the pandemic has brought. And so I think the ability to more have that conversation openly will hopefully do exactly what you just said, which is like swing that pendulum towards the connection of what we all just went through and what we're all trying to recover from. And for some people, that included developing an addiction, relapse of an addiction, worsening of an addiction, and make all that part of connecting to try to recover from that as well.
Absolutely. I really hope that's what happens. So talking mental health and addiction are so closely related that you can't even separate the two, right? Can you talk a little bit about the role mental health plays in addiction and vice versa?
Yeah, so they're actually the same. So the way I explain this to people is like when you think about heart disease, heart disease could be a heart attack, it could be high blood pressure, it could be, you know, that you have to get heart surgery. But you think of all of that as heart disease. Those are like the bullet points under heart disease. Addiction is one of the bullet points under mental health. So there is no separating it. And it's because it's the brain, right? It's the same neurochemicals, it's dopamine, it's serotonin, it's glutamate, it's GABA, it's norepinephrine. And so it's the brain. There's no separating it. And so what we see is, even though we kind of artificially separate and say like, oh, you have depression or you have substance use disorder, like you have mental health or you have substance use disorder. These two are coming along so commonly together. We know that 80% of people who are seeking care for a substance use disorder have another mental health disorder, because substance use disorders are mental health disorders. And so 80% have depression, anxiety, trauma, ADHD, bipolar disorder, schizophrenia, you name it, eating disorders. And so when we try to separate those two, what happens is that people don't get the care they need.
Mm-hmm.
I put this in the physical health realm again. It's like if you have diabetes and high blood pressure, which very commonly come at the same time,
Yeah.
your doctor is not only taking care of your high blood pressure and saying diabetes doesn't fall in this course of care, right? It's not happening. And so why do we accept that on this side? We don't at Eleanor Health. That's why your psychiatrist is part of the Eleanor team, right? Because a whole person walks in. So no more can we separate that bullet point other mental health disorders, which is substance use disorders, because those are mental health disorders.
Wow. Such a good explanation. You really are. I could see why they say like, you really know how to break things down into a way that's understandable. So what do we have to look forward to in recovery? What are we cooking up?
I am so excited about this season. So if you listen to season 1, and if you haven't, please do. But if you listen to season 1, you mostly heard my voice and our producer Claire's voice. What we've done for season 2, because it's about all of us and what all of us have been through, is that we're bringing a guest on every episode to talk about what the last year has been like for them, how they're getting into recovery and reconstruction, and really just trying to pull in like a really diverse set of people with experiences so that no matter who you are, you will hear yourself in season 2.
Wow.
And what we hope to do with that is like, we're trying to swing the pendulum, right, Renee? Like we're trying to
Yeah.
actively be part of swinging the pendulum towards connection, because if you can hear yourself in it, then you can see yourself getting on a path of recovery, maybe like that person did.
Oh, I love it.
I'm super excited about it.
Yeah, it's super exciting. What are some of your professional goals outside of the podcast, outside of Eleanor Health? Anything else in mind?
Oh goodness, let's see. Eleanor Health is like, I mean, that is the professional goal. We are trying to change the way people with addiction in this country are treated, from a medical perspective, from a human and values perspective. The podcast, obviously, in recovery, we're trying to reach so many and actively swing that pendulum towards connection. If I had to choose another professional pursuit, I'm co-founder of Physicians for Criminal Justice Reform, which is a national nonprofit. And you don't have to be a physician to join. We need, just like in medicine, like physicians can't do medicine all by ourselves. So we really advocate at the intersection of criminal justice and health. And it's been a great year for that organization also. And so I would say that if I had to add something else to Eleanor Health and in recovery, it would definitely be Physicians for Criminal Justice Reform on the professional side.
Wow, that's fantastic. And I didn't mean that to sound at all like what you've accomplished already is amazing, because it's amazing.
Hey, that's my whole life. That's my whole life.
No, you're killing it. And Nzinga, congratulations on all of your work. Seriously, you are truly an inspiration, and I hope you fully understand your contribution to the addiction space, because the work you are doing matters, and it is so huge. So thank you for trying to help educate. Thank you for eliminating stigma. Thank you for impacting countless lives through your work.
Thank you so much.
To
I
listen
say
to
all the same things to Shatterproof. It's really just, yeah, it's really
and we
just been
just love you
amazing the
back.
impact you're making.
So to listen to Dr. Nzinga Harrison on Lemonada Media's In Recovery, head on over to www.lemonadamedia.com and click on podcasts, then In Recovery. We'll also post the link below. Nzinga, thank you again for everything.
Thank you. Have a good one, Renee.
You too.